Hello, my name is Dr. Dewan S. Raja. Today I will discuss about restless leg syndrome. This is a sleep disorder. It is also called Willis-Eggbom disease. So what is restless leg syndrome? This is a neurological disorder characterized by uncomfortable sensation in the leg like itching, crawling, or compression, and an irresistible urge to move the legs. This sensation typically occurs when a person is at rest or trying to relax, such as when sitting or lying down, and often worsen in the evening or at night. There are two types of restless leg syndrome. Some author says two types, others don't differentiate. So if we classify into primary and secondary, primary is familial, it is usually little early onset, and there is no other predisposing factors. Secondary due to some other predisposing factor other than family. International Restless Leg Syndrome Study Group criteria: an urge to move the legs, usually accompanied by uncomfortable sensation in the legs. Symptoms that worsen at rest are relieved at least partially by movement. Symptoms that are more prominent in the evening or at night. Symptoms that cannot be explained by another medical or behavioral condition. So, what is the prevalence and predisposing factors for restless leg syndrome? It is quite common, maybe around 5 to 15% of population has some type of restless or some extent of restless leg syndrome. Age, any age, but usually occurs after the age of 40. Gender, male to female is 1:2 ratio, that female has 2 times more chance to get restless leg syndrome. Genetics has an important role. Sometimes it runs in the families, particularly primary type of restless leg syndrome. Pregnancy symptoms can occur or worsen during pregnancy due to hormonal imbalance. Medical condition: certain medical conditions like iron deficiency anemia, obesity, diabetes, kidney disease may exacerbate restless leg syndrome. People with history of renal dialysis has also in many cases history of restless leg syndrome. Certain medication or substance abuse like antidepressant, antipsychotic, alcohol or caffeine may exacerbate restless leg syndrome. What is the pathophysiology of restless leg syndrome? Potential causes of restless leg syndrome. Actually, exact cause is not known. These all are potential causes, including dopamine dysregulation. This happens usually in the afternoon time or relaxing time. Dopamine level decreases. Iron deficiency, so people has more restless leg syndrome. Iron deficiency and genetic factors. Beside dopamine, other neurotransmitters like glutamate, serotonin, and opioids may also play a role in restless leg syndrome. Imbalances in these neurotransmitter systems can contribute to the development of restless leg syndrome. Okay, symptoms. Restless leg syndrome symptoms. Differential diagnosis: peripheral neuropathy, nocturnal leg cramps, anxiety, mood disorder, or antipsychotic or other drug-induced akathisia. Complication: restless leg syndrome can affect individual sleep, daily function, and overall quality of life, including the potential association with comorbidities like insomnia and depression. Now we'll go to the treatment of restless leg syndrome. Restless leg syndrome can be treated using a variety of methods such as pharmaceutical intervention, lifestyle changes, non-pharmacological therapy like exercise, relaxation technique, avoiding sleep deprivation, and attempting to decrease body weight, particularly the obese individuals. Medication like dopamine agonist, one of them is this, ropinirole, Sinemet, combination of levodopa, carbidopa, anticonvulsant, as for example gabapentin, opioids, benzodiazepine, iron supplements are frequently used to treat restless leg syndrome, but we must take care of these two drugs. Opioid, benzodiazepine may cause dependence, okay, or this may lead to opioid may lead to addiction. So it should be used judiciously. Usually these are the treatment. This may be given according to the physician's judgment. Long-term management of restless leg syndrome, which emphasizes the necessity of keeping an eye on symptoms, modifying treatment regimens as necessary, and taking into account the potential for medication augmentation over time. And that's all about the restless leg syndrome. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.